Got it. Thank you so much, Emily. Good afternoon, everyone. We now have 32 participants on this call. My name is Mona Aika, and I'm a child protection specialist for UNICEF East and Southern Africa Regional Office. I want to extend a very warm welcome to all the government. I think someone's microphone is on. Kindly mute your microphone. Or is that the interpretation? Emily, can you hear that?
Yeah, I'm just muting it, Mona.
Oh, thank you.
On the case.
Wonderful. That's better. Yeah, I started off by extending a very warm welcome to all the government representatives who are with us today. We have Changing the Way We Care colleagues. We have UNICEF Child Protection colleagues, and we also have various CSO partners working in the area of care reform in the region and I'm sure beyond. But before we start, I'll go through quickly some of the webinar protocols that will help us to have, hopefully smooth and lively session. So if you haven't done so already, please introduce yourself in the chat box by typing your name, your job title, and the country you're calling in from or where you're working. And also, just as etiquettes of the webinar, make sure that your microphone stays muted throughout this session, so that we don't have any interruptions. And of course, if you have any questions in the course of the webinar, feel free to type it in the chat box, but all questions will be taken at the end. And at the end, you may raise your hand, the virtual hand, if you want to ask a question directly. And of course, this webinar, as you've heard in the beginning, is recorded and will be shared after this session for your reference. And also, if you like to join and you haven't joined already, the mailing list of the East and Southern Africa Regional Learning Platform on Care, you need to complete a short Google form, which I'm sure will be pasted in the chat box by Bertha. Now let me start off by introducing the learning platform. This regional learning platform on care was established by UNICEF, East and Southern Africa Regional Office, ESARO in short, and we did this in collaboration with our partners, Changing the Way We Care, and to really exchange learning on care across Eastern and Southern Africa region. The management of the platform is supported by our esteemed partners, consultancy firm, Child Frontiers, and we have Emily Dillop as the lead consultant of this work. And we also have some of her team, Bertha and others that are online, which you haven't seen yet. So for those who are joining us for the first time, this regional learning platform on care reform is here to provide an opportunity for government, UNICEF, CSOs in the region and beyond to share learning on care reform. Our activities began as far back as October, I think it was October 2020, and we've continued to roll out these webinars and production of different publications on care in the region.
I think we might have just lost Mona.
It was made possible with the support of USAID, Displaced Children and Orphans Fund, through UNICEF ESARO. Now, let me introduce quickly the webinar. As many of you already know, because you've signed up for this. This webinar today is on preventing family separation. And the webinar will explore key strategies for preventing family separation, drawing on examples from across the region. So a very warm welcome. You will see various slides being presented, so no panic. All the slides that will be presented today will be shared in a Google Drive. And Bertha kindly paste the Google Drive nearer the time. And of course, we have simultaneous interpretations available. So we have that in French and Portuguese. If you haven't done so already, you can see the instructions there. Go to the bottom part of your page, of your screen, and click interpretation and click the language that you like to follow through this webinar. And all of those that are going to follow this in English, we are encouraging you to click the English option so that when you speak, the interpreters can hear you and they'll be able to translate, to interpret to the others in the two languages, French and Portuguese. Now, without further ado, I'm going to hand over to Emily, who will give us a brief overview of the webinar and introduce the various speakers that we have today. Over to you, Emily.
Thank you, Mona. I'm actually going to hand over to Crispus from Changing the Way We Care, who's going to be co-presenting with me now and is going to just begin the presentation from the webinar. But just before we get started, to say that we would be really appreciative if as many of you as possible could stay on at the end of the webinar just for 30 minutes to participate in a session evaluating the platform. Unfortunately, this session will only be in English, but if any of our French and Portuguese participants would like to take part in the evaluation, they can message me in the chat box or send me an email and I'll be happy to facilitate that. Okay, so over to you, Crispus, for an introduction to the webinar and an introduction to our panel.
Thank you so much, Emily. Thank you, Mona, for that first session. I am Crispus Natala, and I am from Changing the Way We Care. This webinar is actually based on our new paper on prevention. And as Emily said, Emily of Child Frontiers and myself from Changing the Way We Care will present sections of the paper and then bring in our panel to provide examples to illustrate the concepts from the paper itself. We have a few panelists with us. I will quickly introduce these panelists. From Changing the Way We Care Kenya, we have Edith Apio, who will be one of the panelists to respond to some questions within the session. We have a panelist from Investing in Children and Their Societies. This is Beatrice Ogutu. I hope Beatrice has managed to join already. We have Genevieve Owa Maria from UNICEF Rwanda. And we have Manikanji, who is a senior social worker from the Ministry of Health and Social Services in Namibia. Lastly, from Ekisa in Uganda, we have Jared Shepman, who is one of our panelists. With that, I want to invite Emily to take us through the first part of our presentation. Over to you, Emily.
Thank you so much, Crispus, and thank you to our panelists for joining us today. Okay, I'm just going to put this onto slideshow so we can see it more clearly, hopefully. So just to start off the presentation, I'm going to discuss some of the definitions and terms that we're going to be using in this paper. So when we talk about the family, we mean, generally speaking, those related by blood or marriage, though we appreciate that definitions of the family vary by context because the family is really a social construct. So other people may have different perceptions of who belongs within a family. But there are lots of different family types. There can be single parent households, multi-generational families, and also in some families it involves kinship care, which is care by a member of the extended family or friends of the family that are looking after a child when children cannot. So preventing family separation means stopping children from being separated from all of these different family types that I've been describing. So it includes preventing separation from parents and extended family caregivers. And family strengthening involves strategies to empower families and enable them to care for children well. And when we're doing family strengthening, it can also be used to support children in foster care, children who have been separated and are being reintegrated back into families, and children in child-headed households. And of course, all of those arrangements are also families. But in this paper, we're just focusing on prevention and family strengthening in relation to preventing separation from parents and extended family caregivers, because we know that the needs of foster carers, children being reintegrated, and child-headed households are quite complex, and we're not able to go into all of those complex needs in this paper. But many of the findings will be relevant to those groups as well. So family strengthening can take place at 3 different levels. The first is the primary level, which is targeted at an entire population or a population subgroup. And it's really seeking to provide supports before major problems occur within the family. So this might include, for example, a social norm change campaign that's targeted across the whole population. The second type is, sorry, just give me 1 second. I'm just trying to mute. There we go. The second type is secondary prevention, which is targeted at communities or families where there's a high risk of separation and to prevent problems from escalating. So this might, for example, include a targeted parenting program. And the third type is tertiary, which involves specialised interventions aimed at families experiencing an acute crisis, which is likely to lead to separation. So separation is really imminent and we're trying to stop that from happening. And that might include, for example, intensive case management support. So why do we need to prevent family separation? Well, it's highlighted in international guidance, such as the Convention on the Rights of the Child and the Guidelines for the Alternative Care of Children, in regional guidance, such as the African Charter on the Rights and Welfare of the Child, and many national legislation. And all of these policies state that it is a priority to prevent separation, that in care reform processes, this is something we should be prioritising. And it's also a priority of children, families and communities. So when you speak to children about well-being, you often find that they... Excuse me, sorry. I'm just muting at the same time. I was trying to speak to you.
Mute your microphone. If anybody is just joining us,
thank you.
Please make sure your microphone is muted. Thank you so much.
Thanks, Mona. Yes, so when you speak to children, families and communities about their priorities, often they'll talk about the importance of children growing up in loving and caring families where they're protected and looked after. And sometimes that is prioritised over and above material concerns, such as having enough food to eat. We also know from lots of evidence, for example, on the harm caused by institutionalisation of children, that separation is harmful to child development and well-being. And of course, preventing separation from happening in the first place is far more cost effective than trying to work on reintegrating children back into families once they've been separated and providing them with alternative care. Okay. So the drivers of separation, the factors that lead to separation are quite complex. And it's very rare for it just to be one factor, such as poverty, for example. Often it's a combination of factors. So in the paper, which will be coming out in the next few weeks, and we'll share with you via our mailing list, we talk about a range of different factors that exist at the level of the society, the community, the family, and the child that are common in the region. And I've just provided a few examples within this table for you to look at. And we talk both about risk factors, which are factors that obviously exacerbate the risk of separation, and protective factors, which are factors which enhance the resilience of the child or the family or the community and prevent separation from happening. So I think it's quite important we looked at both those risk and protective factors. And research really needs to happen in each context to determine what those factors are and to try and to try and tailor programs to each individual context. I'll just give you a second to take a quick look at that. Okay. So there are a number of principles in family strengthening activities that need to be taken into consideration in all of those activities. And the first and foremost one is taking a strength-based approach, an empowering approach. And this means rather than just looking at the problems and the deficits in families and children and communities, we are looking at the strengths that exist in those settings that prevent separation from happening. So we're trying to identify those protective factors and build on them. We try and use a child-centered approach that focuses on the best interests of the child. So making sure that all decisions made about when and how a child should be separated from their family are made with the best interests as their primary consideration. And of course, approach that involves doing no harm, that involves avoiding deliberately or inadvertently causing harm to children through family strengthening activities. We also want to enable child and caregiver participation, so consulting children and caregivers in the design of our interventions, but also involving them in interventions, for example, in peer-to-peer caregiver support groups. And understanding and building on wider community supports. So looking at not just the formal aspects of the care system, such as policies and legislation and social work interventions, but the less formal aspects within the community that are often sort of the most important source of support to children and families in the region. Having a strong focus on disability, because we know that disability of both children and caregivers can be a major driver of separation in the region. Working to promote gender equity. So this means addressing gender-based violence that can cause separation and encouraging men to have a stronger role in caregiving through our family strengthening activities. And developing solutions that are context specific, so reflect each setting, but also recognise the unique challenges and protective factors within each child and family. And finally, a focus on sustainability. And this involves, of course, a lot of work with government to ensure that all of our interventions are really integrated into national care systems. Okay, so we really need to try and create a strong enabling environment. So this is the care system, ensuring that this system is really orientated to preventing separation and keeping children within families. So this means building up an evidence base on the causes and effects of separation, developing policy, strategies and guidance that include a really strong commitment to keeping children within families, and outline the key components of strategies to strengthen families and prevent separation. A strong focus on coordination and collaboration. So we know that those causes of separation often involve factors that are outside of the control of the child protection sector, related to poverty or lack of access to education. And we also know that often responses to families that are high risk of separation require interventions from a range of different actors, NGOs, government actors, those in the health sector, education sector. So we need to coordinate and collaborate between all those actors. We need a strong social service workforce that's really committed to preventing separation, that is located within communities so they can work strongly with families, and that has the skills and knowledge to work on prevention issues. We need adequate financing to ensure that enough money is going into the care system generally, but specifically that resources are being prioritised and devoted to prevention. And we need supportive social norms. We know that many social norms in the region are already supportive of prevention because of the strong belief in the importance of the family. We need to build on those norms and challenge norms such as support to residential care, the acceptability of residential care, to make sure that all the norms are supportive of preventing separation. We know that separation is increasing as a result of climate change, which is leading to a lot of an increase in emergencies and disasters. So we really need to look at humanitarian systems and how they respond in those settings and make sure that they are preventing separation, and to link those systems with development systems so we're not creating two separate systems. And we also need to create better services around separation, preventing separation for families, to empower and strengthen families. And we're going to come on to those services in a second. But before we do that, I wanted to focus on two of the areas that we have listed on this sheet. The first is around workforce strengthening, and the second is around coordination and collaboration, and bring in a couple of our panelists. So first of all, Genevieve from Rwanda, from UNICEF Rwanda, I wonder if you could tell us, apologies, what role community volunteers play in Rwanda in supporting prevention and how they have been trained to fulfill this role. So over to you, Genevieve.
Hello.
Hi, go ahead. Lovely to see you. Please go ahead.
Yeah, okay, I was muted. Okay, thank you, Emily, and greetings again to colleagues all in this call. I think, first of all, I think I have to briefly, in 5 seconds, explain who are the community-based volunteers in Rwanda, for those who are on this platform the first time. These are volunteers in the child protection sector there are 2 per village, a female and a male, who are elected from within the community by their peers. And they really, they are there to support children in terms of protection. And their role, the role that they have been playing, as the article has been presenting, their role is identified at all the 3 layers. At the primary primary level, the ISU are conducting a community dialogue. In Rwanda, there are different forums, like in Uganda, this is the community work, which happens every last Saturday of each month. And they are when they are in their village, because the Uganda is taking place at village level, they are taking a slot to talk about the child protection, for example, about the social norms, on the belief about the physical punishment, on abuses on children, and encouraging also parents for positive parenting. And on the secondary level, this is the main part of their work. They conduct home visits, and they go specifically to some all homes within their village where there are children. They make home visits, and the frequency depends on the situation or the status of that particular household. If it is a household at risk, they intensify home visits, but for other homes, they do like once a month, because these are volunteers who are not paid. This is not something that should take much of their time. And at tertiary level, they are also identifying those households that are really in imminent risk of separation. For example, where there are like families in conflicts, some have played the role of mediation of their peers within the community, where there is, for example, different abuses on children. So they identify all those sorts of child risks, and they intervene early to prevent further separation. For example, during COVID-19, they were different. They have really played a very good role in preventing separation, because most of the families, those that were already fragile, have been even more vulnerable during COVID-19, and those issues have played a key role in supporting those families, advocating for linkages with the social protection, supporting those families, children who were left alone when parents during the time of like lockdown. So this is the nutshell. I'm trying to go fast because I have 10 minutes, I think, only. Yeah, this is a nutshell, the role that they play.
You only have 5 minutes, I'm afraid. So
okay.
You just got another couple of minutes to go, but you've answered the question beautifully. So just wrap up. That's great.
Yeah, for the training, the ISU are having, there is the pre-service training package, which is mainly when after being elected, the pre-service is to inform them about their role, who are the other stakeholders that they are going to collaborate with at the village level, and how they are going to report on some of the aspects of abuse and the risks. And then after when they are deployed, we have now been developing different training modules, thematic training modules, including children in emergencies, including supporting children with disabilities, violence against children, and of course, one on child protection in general in the context of Rwanda. And there is one which is being developed on supporting children human health crisis based on the needs that were identified during COVID-19. I have tried to just summarize.
Wonderful.
I think
you did a great job.
You.
And if anybody has any questions, if they can just pop them in the chat box. Right, I think we are very delighted to have with us Mani Kanji from who's a senior social worker with the Ministry of Health and Social Services in Namibia. And Mani, I hope you're able to tell us about how you have enabled effective coordination and collaboration in your efforts to promote better parenting in Namibia. So over to you.
Thank you. Thank you. Good afternoon from Namibia. Thank you for having us on this platform. In 5 minutes, I need to tell you.
I know it's a challenge, but people can ask you questions at the end if they want more detail. So thank you.
Yes, thank you for this. Parenting program, as we know from our communities, we have our cultural parenting perspective. We have our formal approaches to parenting. But what we have thought as a Ministry of Health and Social Services, we have a mandate for developing and implementing parenting programs in Namibia. But for us to also ensure that we have better collaboration, we thought, where will we start? So that at least we know we have all the stakeholders on board. So what we have organized meetings with the key stakeholders that we know that they are having parenting programs, or they have a priority of initiating parenting programs as per their mandates. So we look at the government ministries, like when you look at the Ministry of Health and Social Services, who is now us having the mandate. We'll have a Ministry of Gender Equality, Poverty Eradication and Social Welfare that are also having social workers. So when I'm talking about the Ministry of Health and Social Services, I'm talking about social services in particular that I'm also part of. And then we are talking also about primary healthcare services. And then we also look at other stakeholders that are our other partners are development partners. Like when you look at UNICEF, that is also having a mandate on parenting. We look at Global Fund. We look at also other organizations that in our community, like Project Hope, Lifeline, Childline, that are also having like an open line for emergencies. So what we have done to ensure collaboration, we have called a stakeholders meeting in order for us to first map what is really happening on the ground, in order for us to be able to know that everyone should own these programs from the start and we don't leave anyone behind. So when we did the mapping exercise, we wanted to see that what are the achievements that the different organizations are having, what are the challenges that they are having in terms of staff that are supposed to deliver this program, in terms of like outreach to the communities, and in terms of funding. So we did a mapping exercise, and then after that, we look at the priorities as per their mandate, we look at the challenges. So what we have done, we have taken the positive efforts from the others, and we have also looked at the challenges. And we have established a technical working committee. We call it a technical working committee that is different, like it's a multi-sectoral or interagency committee, looking at what are the priorities that we would like to see in Namibia, how should the programs be. So when we were looking for funding, we had two main objectives, is to develop a strategic plan for the next 5 years from this technical working committee in order for us to be able to collaborate and also to channel the resources better so that we also minimize duplications. And then we have also now started to look at developing a national parenting handbook and a facilitator's guide. So we are having terms of reference that are signed by all the different stakeholders so that at least we know what are the objectives, what are the deliverables, what are the time frames. And then also when we are developing these handbooks or tools for parenting, we do it as a unit. We do it together so that we can also tap on the different skills of different partners. And then we are also the one who have to also look together, what are the budgets deliver it. So for collaboration, we have like a quarterly structured meetings that we have to also develop the annual plans or the annual activities together. We have also to design the tools, the parenting tools together. And then also we have also to know what is it being done at the education at school level, because we have like programs or tools that are developed specific when we look at the Ministry of Education for parents, for teachers, for the youth. Then we also have components of community outreach programs. And then we have also programs that we know we can target also the workplaces. So that's what we in a nutshell are doing for collaboration. And we have like regular structured meeting. And as well, when it's a need, then we have ad hoc meetings. So in a nutshell, that's what we are doing for collaboration.
Wonderful. Thank you so much. It's great to hear about that wonderful collaboration and also some of your information about your work on parenting. But I'm going to hand back over to Crispus now, who's going to take us through a little bit more of the presentation. Sorry. Over to you, Crispus.
So thank you so much, Emily. I will take you through this next set of a few slides, and this is in line with the services and support to prevent family separation. We have had quite a good background, and I'm sure while we were listening into Maria, she also gave us very good examples of what these families that could be at risk of separation are. So our first step in preventing separation, of course, is being able to identify those at risk. And we have two levels here. We are speaking about the primary level of prevention, which takes the national level or is focused mostly on the broad groups or parts of the country. And to achieve this, you have to identify the targets. These targets need to carry out a research and find out the drivers of separation so that you can find out which groups or parts of the country are actually vulnerable and prone to that risk of separation. For the secondary or the tertiary prevention bit, you need to identify the specific families that are now at risk of separation. And you can do this in a variety of ways. Some of these ways include using the evidence that I just referred to on those drivers of separation to now then identify these vulnerable families. For example, the families might show, the evidence might show that the families are with elderly caregivers who are especially vulnerable. I have also mentioned that Maria shared some examples of what vulnerable families would look like and those that could end up being separated with their children. You could also ask frontline workers to identify vulnerable families. So by making good use of the frontline workers we have within our countries, we can now include all those with the direct contact with the child or the family. For example, the social workers, it could be the teachers, it could be healthcare professionals, and this will help us to identify those kind of families. Lastly, we could also ask these children and the families who feel they are at risk of separation to come forward and seek the help that could be forthcoming to them. Move to the next slide, Emily. We could also improve decision-making around separation, and the need to improve will basically be in three types of decision-making. One of those decisions is what is made by children. The decisions made by children, families, and communities are especially important in the work that we do. And you could maybe look at providing information and advice. It could be encouraging the parents to put contingency plans in place so that the child can be cared for by a relative if they are unable to do so. We could maybe promote participation in decision-making, and this could really take care of that first category where we are looking at decisions made by these children, the families, or even the communities. We have the decisions that need to be made by gatekeepers and the gatekeeping bodies. For example, this is in terms of for legislation, we could have guidance and training for gatekeeping bodies to make sure that actually they prioritize keeping children in families, which is very important. We could monitor trends in their decision-making to make sure that they are not actually separating too. We could also ensure they are not separating many children, that is, and involving a range of stakeholders in these decisions that are being made by these gatekeeping bodies. Remember, the more eyes, the better, to make good decisions for these families and these children that we want to keep in families. We want to ensure that also gatekeeping bodies are able to make all decisions about entry into residential care, but often that ensure that these decisions are still being made by residential care providers. No, I think often these decisions are still being made by residential care providers, but we want to ensure that gatekeeping bodies are allowed this opportunity to make these decisions about entry into residential care. Pardon for that bit of error. We need to improve this entry procedure so that children are only admitted when necessary. I think you go back to the two core principles of the UNCRC, the principle of necessity and suitability. So it is about entry into these institutions only when necessary and not at will. That is it, Emily. Thank you for that. I want to maybe take this opportunity now to invite Edith from Kenya to share with us how community gatekeeping panels or the case conference committees have been used to improve decision-making around children's care. Edith, remember you have 5 minutes. You can take a bit of a few seconds of that to introduce yourself properly, then get to responding to the question. Over to you, Edith.
Thank you. Thank you, Natala. Just confirm that I'm audible enough.
I can hear you loud and clear.
Oh, okay, thank you. I'm Edith Apio in Kenya, working for changing the way we care, supporting care reform work in Kenya and the Eastern and Southern Africa regions through the Catholic Church. So I'm happy to talk to you about how case conference committees have been used in Kenya to make decisions around children's care. So case conference committees have been established in Kenya through the Directorate of Children's Services with the help of changing the way we care. The committees bring together a range of professionals involved in supporting vulnerable families, and these individuals vary depending on case by case, but may include government children officers, NGO social workers, staff from residential care facilities, teachers, and healthcare professionals. The social worker in charge of the child's case presents the case to the committee, who then discusses the best ways to support the child and family to prevent separation. The committee's goal is normally to ensure that children can remain in families, and where there is not possible, they recommend appropriate temporary alternative care placements. I wasn't able to put it on my video because of internet instability, but thank you so much for that opportunity. Back to you, Crispus.
Thank you so much, Edith. Thank you for helping us understand how the gatekeeping and the case conference committees in Kenya work. I want to return this back to Emily for the next part of the presentation. Back to you, Emily.
Thank you so much, and thanks for that excellent explanation, Edith. So just continuing with these services and support that are needed to support family separation, to prevent family separation. One of the key areas of services is around social services and case management support. So the first thing we need to do in relation to this service provision is to identify, sorry, just give me 1 second to mute a couple of people, is to figure out which families need this support. So identify the families that are really in need of case management support. So as we discussed right at the beginning, when we looked at that triangle of different forms of support, we could see that there's only those families really at the tip of that triangle who were really where imminent separation, with at risk of imminent separation, or where child was at risk of harm, or where perhaps families have complex healthcare, complex needs where case management support is required. So we don't want to provide this to all families at risk of separation, because that is very expensive, it's time consuming, and it can quickly overwhelm the child protection system, particularly in contexts where there aren't so many social workers. So we need to use those services very carefully and in a very targeted way. But when we do decide to use case management support, we have to go through each of the steps of that support. And just to talk through briefly about how those steps relate to preventing family separation. The first is around assessing the child and the family. And this is looking at all the aspects of child wellbeing that may affect, or family wellbeing that may affect the risk of separation, and also to try and identify those protective factors, those strengths within children and families that can stop separation from happening. And then based on that information, we want to develop a case plan about strategies to try and prevent separation, and of course to implement this plan. And as circumstances within families change, often we need to carefully monitor what's happening within families and to review the case plan and revise it to reflect those changing circumstances. And once the risk of separation has been diminished and the family can care for a child well without social services engagement, we can then close the case, and that leaves social workers free to work with other children as well. Okay. Okay, so another area of services and support is around reducing abuse, neglect and exploitation in families, which we know is a major driver of separation. And of course, there are lots of different strategies for doing that. And many of the areas that we are talking about in terms of other services and support will have an impact on abuse, neglect and exploitation. So some families, they would need that intensive case management support. In other cases, it may be around awareness raising or improving parenting or caregiving skills so that they learn about non-violent disciplining. In other cases, exploitation, for example, child labour may be driven by poverty. So you might want to look at poverty alleviation strategies. So going on now to those poverty alleviation strategies, we know that social protection programmes can reduce poverty and many of the other drivers of separation. And there is also evidence of these programmes actually leading to a reduction in separation. So just to give one example, households that receive South Africa's Child Support Grant have an 8% higher probability of children living with their parents than children in other homes. Unfortunately, poorly designed social protection programmes can actually increase separation. So, for example, resources from cash grants from government can be used to pay for the costs associated with child marriage or migration and children being pushed out of families as a result, or to buy alcohol, which can increase violence in the home, and this is a major cause of separation. So we want to design social protection programmes so that they maximise the benefits and minimise the risks in relation to family separation. So, for example, we need to make sure that these programmes are accessible to families who are most at risk of separation. It's a good idea to use the cash plus approach, that's adding on services to social protection, such as awareness raising or parenting programmes that can be used to address other factors that may affect separation. It's a good idea either to have family separation as an explicit goal of social protection programmes, so that's been done in Kenya, for example, or to make sure that we're monitoring the impact of these programmes on separation so that we know whether the programmes are having a positive or negative effect on separation. We need to ensure that those working in child protection and social protection are able to make referrals across their services. And we need to ensure that we don't overload either service. So, for example, we don't want social workers spending all of their time administering social protection programmes and having no time left to deal with child protection concerns. Okay, so we need to ensure that there are health, education and disability services available to vulnerable families, because ill health, long-term ill health, lack of access to education and disability are all key causes of family separation in the region. And those of us who work in the child protection and care sphere can improve access to these services in a number of ways. For example, we can map and try and understand what services exist in our communities where we work and make referrals to those services. We can train frontline workers such as health professionals, education professionals, those working on disability issues, on the importance of preventing family separation. We can help services to reduce family separation through the way that those services are designed. So, for example, we can raise awareness about the risks of separation through adding this to school curriculums. We can also make sure that these services are targeting those most vulnerable to separation. And we can try and ensure that those working on disability issues are providing services in the community and moving away from models that rely on the institutionalization of those with disabilities that separates them from families. Okay, so we've just started to touch on this issue of disability, and I'm going to bring in two of our panel to speak on this issue. First of all, if I could ask Jared Shepman from Ikisa in Uganda to tell us a bit about what they think are the key components of successful strategies to prevent separation for children with disabilities. So over to you, Jared.
Great. Thanks so much, Emily. Am I able to share my screen? But it says that you're still sharing. I need to turn yours off. So I'm Jared Chapman. I'm the Executive Director at Ikisa Ministries, living and working in Uganda. And so I'm excited to share some of the things that we've learned through our work. And I'll also be kind of doing it from the angle of not just what we do, but also what is replicatable by other organizations and entities. So great. So just real quick, and I'll take 5 minutes, but I wanted to look at some of the specific causes of separation specific to children with disabilities. We know that they are more likely to end up in institutionalized care, but with some of those specific things, we look at a lack of services as a primary one. As we talk about services, we're referring to medical therapy, special education, etc. And so generally, this is a gap that exists between what a child needs and what a family can access. It's too far, it's too expensive, or it doesn't exist. So there's often a belief that institutionalized care will be better. Families often don't understand the importance of attachment and how it might affect their child's development. And institutionalized care may also only be the only place where services may be provided or be received. And so that is a common held false assumption. So, and third, and this is where we're going to spend the most of our time, is children with disabilities unwanted. And this is a sad truth, but it is reality, that children are not only stigmatized outside of their families, but also within their families. It also often has to do with their value, because they're unable to contribute to the family, or because they cause a burden to the family with expenses and times. And so in order to prevent these issues of separation, we're going to just talk, we're going to look at three things, but we'll spend most of our time for the next few minutes on this first one. And so that the child must be valued and wanted within the family. And we truly believe that this is the first priority that should be given when it comes to preventing separation. Because if a child is not valued within their own family, then providing services to that family or to that child will never bear full fruit, and you're not solving the issues that are causing separation. So in order to help a family better value their child, we focus on parent education and discipleship. And so the goal ultimately is that a parent changes their view on how they see their child, on how much they think their child is worth. It's kind of a worldview issue of what we're talking about. Stigma is within families. And so we say that stigma is broken down when knowledge is gained. And so a lot of the false beliefs around disability and a lot of stigma comes not from a place of hatred or evil, but it really just comes from a place of ignorance and a lack of access to knowledge around disability. And so providing basic knowledge and combating false assumptions is often the easiest and a very effective way to combat stigma. And third is involving the extended family in the learning and in the daily support of the child, especially in our context here in Uganda and Eastern Africa. The extended family plays a huge role to make sure that the child is succeeding and developing. So in order to accomplish those things, what we utilized here at Ikisa, and which can be utilized by anybody, are home visits, group meetings, forming a team around the child of stakeholders. We mentioned case conferencing, that's similar, and family group conferencing, and then involving the extended family. So utilizing these different means and modes of service delivery, it's through those that we are providing, parent education, parent discipleship, counseling, building community amongst parents and peers, and ultimately, accomplishing that first goal of helping people to become more educated and to rethink the way that they value their child. So, also with this goal, we also have to focus on community sensitization. So we look at the family as itself, but we also look at the greater community, because we know that if the greater community doesn't understand the child and include them or see them as a part of the community, that it's going to hinder the family's own perception of the child and their own place in the community. So we need to focus within the family and within the greater community. So at Akisa, we actually have a tool developed, a guide for social workers that kind of helps along this journey of education and discipleship and combating false assumptions. It's called Finding Value. So if this is something you wanted to learn more about, we'd be happy to share more. It walks families kind of through these stages, where in each stage they're gaining more education, combating those different false assumptions, learning more about their child and how to care for them. So we'd be happy to follow up with that one if you're interested. The second goal is strengthen the family, and I'll just highlight a few things that are specific to disability rather than just general cases. So we need to increase parents' knowledge about their specific needs of their specific child and how to care for them. So this is where you need to have, experts and doctors and therapists and stuff like that who can provide accurate diagnosis and the education on how to meet the needs of that child. The second, when it comes to economic empowerment component of family strengthening, one of the learnings that we've had is that co-op businesses can work very well. There's often limitations on what a family with disability can do in terms of work, because they're at home caring for this child, or taking the child to work comes with stigma. And so co-op businesses we're seeing a lot of success with. And in addition to that, it's also something that just creates community amongst other parents who are going through similar things. Lastly is to connect or deliver needed services. So again, medical, therapy, special education. We say that every child with disability will always need additional support. And there's not a developed country in the world where a family takes that responsibility by themselves. And so they have to be connected to government and private sector services in order for the child to get what they need. And so, some of the things that have to be done in this is we got to increase those services. And the third one here, though, of transitioning existing children's homes or NGOs or OVC organizations, of how can you begin to serve children with disabilities more? It's a very underserved population. Most people don't feel equipped or trained to include or serve children with disabilities amongst their existing programs, whether that be medical, education, empowerment. And so those organizations have to make it a priority to provide that service to this population. So, and then just two other things to consider. One is gatekeeping. Often children with disabilities are unnecessarily admitted into institutionalized care. And sometimes with just very simple interventions, utilizing case conferencing and team around the child and the extended family, looking at the continuum of care, often solutions can be found when a family feels like they want to take their child to an institution where it can be avoided. And the last one is just support should be ongoing. We have to remember when it comes to family strengthening programs that often those come with a timeline or a goal of when a family might graduate off. But with disability, we have to remember that these are children and families who are going to need support for a lifetime. And so while there might be a period of intense kind of working with that family and empowerment, there has to be continuous support. So that's all I have. Thanks so much.
Thank you. That was so helpful. Thank you so much. I'm just going to ask Genevieve to come in from Rwanda to tell us about your learning from Rwanda around the key components of successful strategies to prevent separation for children with disabilities. Over to you, Genevieve, if you're still with us.
Yeah. Okay. Thank you, Emily. In Rwanda, well, we have seen that this prevention is playing a key role in first keeping those children who have been. Are you getting me? Sorry.
Yes, we're hearing you fine. Yes, go ahead.
Okay. Yeah, so the strengthening of community-based volunteers as a part of the social workers or the professional child protection workforce have proved to be very important in sustaining the gains. For example, for those children who have been deinstitutionalized before, these volunteers are playing a key role in keeping them in the families through the regular home visits, but also they are also at the center of increasing like early intervention at the family level in a way that helps to prevent family separation. For example, when they go for home visit, they identify those families that are at risk, and they link area enough with the different services like in the child protection component so that they can be supported. And also they are playing a role in preventing further abuse to children, for example, with the early detection and the early referring of children at risk, or those who are already faced this, who have already faced this different abuses, so that it can prevent from worsening the abuse at the family level, and also bringing in the parents and the children together to work more on family togetherness. Yeah.
Thank you so much. That was another extremely helpful example. I hope we've all gained some insights from that. So I'm going to hand back over to Crispus now for the final part of the presentation, and one more input from our panel, and then we'll have an opportunity for question and answers. So if you have any questions, please do pop them into the chat box. I can see a couple have come up there already. Over to you, Crispus.
Thank you. Thank you so much, Emily. Thank you, Maria, and thank you, Jared. It was a pleasure listening from you again, Jared from Ekisa, and I have to agree that I have interacted with the package on finding value and seen how it has helped transform some of the lives of the children with disability that were received from institutions here in Kenya. So thank you so much for sharing with us about that package. So to continue from where Emily left her, we will look at continue looking at the services and support that we can look at to prevent family separation. And one of those things we want to look at is, I think you need to start from the previous slide, Emily. Yes.
Apologies.
That is okay. So we want to look at how building connections to the wider family and community could also be of help to these families to prevent separation. And of course, extended family and the community support is a core strength that these families and children can rely on. So we can build on this in a number of ways to prevent family separation. For example, we could promote community participation in service design and delivery of our programs. We could use this to trace wider family support networks. We could do training to the workforce to appreciate the value of this support and to help build this into their case management, for example, and also mapping of community organizations that will support families to continue staying together is one other thing we could do to build those connections. Next. We could also look at how parenting or caregiver interventions could promote the strengthening of families. And this includes parenting programs, of course, peer support groups, and mentoring. The tendency just to focus on structured parenting programs, for example, classes each week, but there are other ways to give this kind of support. One, we can target parents and other family caregivers as other people are involved in children's upbringing too. Remember, children are not just brought up within the families or by their carers. There are other people involved, and we could target them with this kind of support. We can reduce separation and the cost of separation, but we have to be careful not to overstate actually the benefits. We could, for example, the reason I say that is because there is some evidence to show that we can reduce violence in family, which is a major cause of separation. And it also shows that these programs can reduce separation. But important to note is not overstating these benefits for the reason that, for example, there is often limited evidence on the longer term impacts that we can realize. These programs also don't address many of the root causes of separation, such as poverty or lack of access to services. So those are things that we have to be mindful of as much as we do these parenting or caregiver interventions to help prevent family separation. We can move to the next slide. We could also continue to ensure that the number of lessons learned on parenting, we have a number of lessons learned on parenting or caregiver interventions from the region. And some of these are parent, carer, or child-led. For example, there's need to consult children. We have to consult children, parents, and the caregivers. For children, we have to find out what, for example, the kinds of caregiving they would like to receive. It is important to engage children and have them participate in meaningful decisions about their lives. So that is an input that children could give. For the parents or caregivers, they could help us understand the type of support that they want and how they would really like to receive this support or have it delivered to them. We could also focus on the exchange of learning rather than the lectures that we are used for. Remember, these are parents, carers, and these are children. It has to be a very good method you use to ensure that you actually support them well and not necessarily taking them through lectures. We could also use active learning and combine the theoretical with the practical. For example, tools such as role plays and exploring scenarios are very effective. Parents and caregivers find it useful to have both theoretical knowledge on things like development stages and even the practical guidance that comes with that. The strength-based and non-judgmental principles are really key. Programs should always seek to identify and build on strengths that these families already have. Remember, we don't find them from a blank space. They already possess some strengths that we have to build on. And facilitators should always try to understand why a parent or a caregiver, for example, may consider family separation. Recognizing that these choices often arise from a lack of services and support, rather than the parent being what we would say, quote unquote, a bad person or a bad caregiver. We also have to ensure we are being context specific when we are trying to give this parenting or caregiver interventions. We have to ensure that they cannot be, because this cannot be imported from one context to the other. We have different backgrounds, we have different cultures, so that has to be taken into consideration. We have to be inclusive and always promote gender equity. There's need to think about who is involved in children's upbringing, and this includes all of these individuals in these programs. So there is no reason for us to leave anyone behind, but we have to ensure we are being inclusive and we promote the gender equity. We also have to tailor our support and recognize that not all the caregivers have the same needs. People have different needs, and it is from these unique needs that we can then help address and design interventions that will keep these families together. And we also need to work in conjunction with strategies that are designed to address structural causes of separation. And these are parenting programs that should never be viewed as the solution to violence in families or family separation. There are other interventions that deal with poverty, inequality, and even lack of access to services. So these are also needed, and it is important for us to always consider them as we try to give this support that will keep the families from separating. I would want at this point to appreciate that we have with us one of our panelists from investing in children and their societies, that is Beatrice Ogutu. And Beatrice, I would like you to use your 5 minutes to please tell us about the Family Together program and how this is being used to prevent family separation. Welcome, Beatrice.
Thank you very much, Natala, and good afternoon from Kenya. Colleagues, I'm really happy and appreciate the presentations that have gone before this particular discussion. Indeed, there's a lot of experience in the region with regards to the strategies that are working towards preventing family separation. My name is Beatrice Ogutu. I work at Investing in Children and Their Societies, ICS-SP. And together with Catholic Relief Services, we are implementing the Changing the Way We Care initiative in Kenya. And within the Changing the Way We Care initiative, we have the Families Together program. This program aims at preventing family separation by way of strengthening the protective factors at home level. Particularly, this program builds on and strengthens the capabilities or knowledge of parents and caregivers, and sometimes also promotes the development of new competencies so that parents and caregivers can take care of their children well and protect them with the risks that are associated to separation, some of which have already been shared by the earlier presenters. So first, this particular program has a parent education component that is organized in 10 modules. These 10 modules are packaged in a semi-structured curriculum, and we deliver this curriculum through 2 different ways. One, we target families at risk of separation. They're mobilized and grouped together through peer groups, and then we deliver the 10 modules over a period of 10 weeks, once a week over a period of 10 weeks. Sometimes it goes over to 12 weeks. And we use a number of participatory methodologies that Natala has just presented in the previous slides. Again, this program targets those families that are integrating. These families access this program through home visits. There are structured home visit guides that are used to guide the home visit sessions. And for both families at risk of separation and those who are integrating children back, the program is delivered through the community level workforce made up of officials and paraprofessionals that are drawn from different government agencies. Key here in Kenya being the Department of Children's Services, the Directorate of Social Development, with support of other social protection departments within the various ministries within government. Secondly, beyond the parent education and training to reinforce what they have reflected together on in the group sessions or through the home visit, the program supports social connection with each other, especially the peer group approach where parents come together, reflect on their strengths, reflect on their challenges, and together they're able to come up with homegrown solutions. So the paraprofessionals are just reinforcing together this. But we also are proactive in strengthening community-based services so that we can connect families both at risk and those who are already separated to various basic and specialized services that they need based on the case management approach that was earlier mentioned. And thirdly, what is also a critical component of the Families Together program under the Changing the Way We Care initiative, we work to ensure that residential care institutions are able to transition from institutional care to family and community-based care. So we've worked with a number of residential care providers, supported them to understand the importance of having prevention initiatives, the importance of reintegrating children back home and in different forms of alternative care. And majority of them have actually been positive in terms of embracing this new way of taking care of children. And we are happy that the prevention aspects of it is also gaining traction and is well supported by our national policies here in the country. So in brief, that's the Family Together's program delivered through structured curriculum, which has 10 modules and targets those 2 categories of families that I've talked about. Over to you, Natala.
Thank you so much, Beatrice, for that elaborate response. I think you've done justice to help us understand more about the package and how it is supporting families to prevent separation. Indeed, it is a pleasure working with ICS in the Changing the Way We Care project to ensure that our children keep staying in families. Thank you so much for finding time to share with us. I want to give this back to Emily for the next session.
Thank you so much, Crispus, and thanks from me too from that presentation from Beatrice. It was really interesting to hear about how residential care providers can be encouraged to prevent family separation, to move from that model of providing residential care to supporting family-based care. So thank you. We have a few questions for the panel in the chat box. And please add any additional questions you have. I hope I'm going to capture all of them. So for Genevieve, firstly from Rwanda, if she's still with us, Genevieve, I'm just checking because I know.
Yes, I am.
Yeah, brilliant. Okay. We had several questions from you, so I'm going to ask them all together and you can hopefully answer them. So first of all, how do you support the ISU to avoid burnout? then do the ISU work in other sectors as well as child protection? And if so, how do they balance their contributions to other sectors with their work on child protection? And finally, how does the supervision, support and reporting structure for ISU, what does that look like? So over to you for those questions.
Yeah. Okay, thank you. On the first question, very straightforward, for the support and the burnout, unfortunately, currently there is no formal way of supporting, framework of supporting the ISU. We are currently having now a consultant on board who is developing a strategy framework for addressing burnout for both the ISU and the child protection professionals, because we don't have, it is not existent for none of them. Otherwise, they are just using informal peer-to-peer. They have a WhatsApp group where they can share experiences with the CUG, which is not paid. They are not paying because they are given the phone as job aids, and they are able to share experiences with their peers, and they call for support from the child protection professionals under their geographic supervision. This is also coming to the question of how they are supervised and reporting. ISU at village level, they have a structure which is going up to district level. They have their representative at the cell level. This is the next geographic entity after the village. Then after the cell level, they have the one at the sector level, who is supervising or overseeing the ISU work at all cell levels, and at the cell level, they oversee all villages within the same geographic coverage. But also there are the child protection professionals at district level who are providing technical guidance and supporting. In fact, ISU are not taking, are not addressing all the issues. Most of the time they have to refer to child protection professionals, because some of the issues affecting children are requiring a professional, more professional skills. So these are just volunteers. And coming to the other question, whether they are working for other sectors, this is no, they are just working for child protection. There have been several attempts from different sectors to involve them into other community issues, but the National Child Development Agency, which is in charge of this parasocial, has really categorically refused. But there are other volunteers in the community. For example, we have those in charge of community health workers. For example, we have what we call the parasocial workers for the social protection. They are just collaborating for referral, but they are not intervening in other sectors. I think I have addressed all the questions. And there was also one question that was asking about how they are supported to. Oh no, I think it is the same question. Huh? Or maybe
how they were supervised and supported in terms of reporting.
Yeah, in terms of reporting, there is a system. What they are given job aids. Part of the job aids, they are giving mobile phones, and they are able to report through the USSD code. They can report cases directly, which go directly to the child protection and the welfare officer professional who is in charge. They are also able to report through the 711. This is a toll-free call that they can use to report urgent child abuse. But also they collaborate with the local authorities, and the local authorities really are trusting them, because they have supported in safeguarding most of the issues that are affecting children and the families. Also, the local authorities have interest in working with them. They are really supporting them when it comes to reporting, to supporting, or to raising issues in the community, or sometimes they can also go to police when it is a case of abuse, which is a crime, which require immediate intervention. So they are really collaborating with the local authorities. Yeah, over to you.
Thank you so much. That was a very comprehensive answer. There's been some questions and exchange in the chat box around asking Akisa for some of their great resources. And I think there's quite a lot available online. Is that right, Jared? And you're also happy if people want to get in touch with you directly to share further resources?
Yeah, we actually at Akisa, we have a whole department now that's just devoted to training and equipping other organizations. And so we try to take everything that we're doing here as practitioners and turn it into trainings and things, because we believe it's the best way for children with disabilities to be served. And so, yeah, reach out. You can try our website. There's stuff available on the website, links to our resources and other people's resources. But we have a department here that does lots of different trainings and can help on most things disability. So we're happy to.
That's so wonderful to hear, because you're doing such great work. It's good you're able to spread that around the region and more widely. Thank you for that. There were a couple of questions from Namibia to Beatrice in Kenya around how you ensure that that you keep parents motivated to keep coming to your parenting programs. And there was a second question. I just want to make sure I get this right. I've lost it, but I think it was looking at how you ensure that financial support or support being offered through those parenting interventions is coordinated to avoid kind of duplication, so that families aren't receiving multiple services from different agencies within Kenya. So Beatrice, are you able to respond to those questions?
Thank you very much, Emily, and thank you for the questions. In terms of motivation, the foundational aspect is around whether the program is actually targeting the needs of the families themselves. So relevance. So relevance would be the first issue to check, because then when families feel that there is a program that appreciates them, builds on their capabilities and strengths, and is not there to judge them, that is great motivation that we've been able to see. And I think that's one of the principles that Natala also highlighted in the slides that he talked about. So building on the strengths, appreciating the challenges that the parents are experiencing, and the topical module should be relevant to address the challenges that the families are going through at that particular time. The second motivational consideration is around the timing of the sessions. So we have a module that is delivered once a week over a period of 10 to 12 weeks. And you have to be flexible enough to be available when the parents are available. So you're not forcing them into a corner to make themselves available when they are fending for their families, they're engaged in other things. So that has enabled us to maintain motivation and retention throughout the program season. So being flexible to ensure that you meet them at the time that they are available. The third one, beyond the parenting sessions, the families are connected to various basic, specialized, and social protection programs. So it's not only reflections, knowledge sharing, practice session, but based on the case management approach, then they're able to access other services that we offer within the larger context of the Changing the Way We Care program. And this includes household economic support for families who are struggling with income issues, who cannot pay for their basic needs. So this has encouraged and inspired them to stay on the program, and retention has been well above 76 to 80%, depending on the different regions where we are implementing this program in Kenya. The other aspect of the question was around how do we ensure there is no duplication. One, the multi-sectoral approach that we have adopted within the larger Changing the Way We Care initiative brings players together at community level, players from government, from other civil society organizations, and ourselves as implementers, to assess the situations together, to see who will provide what package of services. And then through the case management approach, we are able to map what families will get what services from which service providers, be they from civil society organization or even from government itself. So that multi-sectoral coordination at community level where the program is being implemented remains key to ensure that there's no duplication of efforts, and also ensure that services that are not being provided under the Changing the Way We Care initiatives are also able to, we are also able to leverage on the other service providers within those particular communities. Our monitoring frameworks also enable us to see the whole package of services that families are accessing. And we're encouraging them to access all these services from other providers as well. So when we are documenting what the families have received through the case management approach, it enables us to know also what we can leverage from and what we can access from other service providers as well. We also work with government to ensure that the targeting for the social protection programs that the government are offering for orphans and vulnerable, for those with disability, and for the elderly is also targeted to the right communities that we have identified through our mapping exercises and vulnerability assessments. Thanks, and over. I also saw there was another question on whether we could share the package that I mentioned in my presentation. Yes, we can connect bilaterally on this so that we can take discussion forward. Thanks, and back to you, Emily.
Thank you so much. You will see in the chat box that I've added a couple of documents, and one document and one video, which is Beatrice mentioned in her presentation the wider work, the great work that Changing the Way We Care have been doing in Kenya. And we've documented some of this work in one of the counties where they're working as part of the learning platform. So you can see a written case study, but there's also a really nice just 10-minute video which explains that work. Okay, I think that's all we have time for in terms of questions. I'm going to hand over to Mona to wrap up the webinar. Just while Mona's getting onto the screen, I'm just going to ask you to please complete a very short poll. There's 2 questions there for you around who you work for and also where you work, so that it's really helpful for us to get a sense of who's in our webinars. Thank you. Over to you, Mona.
Thank you. Thank you very much. This webinar has been really engaging, and I have definitely learned a lot. I want to start off by thanking the esteemed panelists that, for sharing with us invaluable insights on effective family separation prevention and, most importantly, family strengthening. We heard from various countries in our region. I think if I remember correctly, Kenya, Rwanda, Namibia, and Uganda, and really thanking all of you. I have definitely learned so much from the experiences across the diverse countries in our region. Some are from the East and the South, so that's really nice. I also want to express my appreciation to the participants, to all of you, for also actively engaging through the chat box, and the questions you've asked were really good, which expanded the knowledge and for us to learn more. Special thanks to Emily and Crispus for facilitating this webinar very well. It was really interactive. I really enjoyed the flow of the whole session. I think we've already, Emily, you've already announced that we need to complete a short poll on who is in the meeting. This is a very important action for us, because we want to know how much we're reaching, where we're reaching. And so please make sure, if you haven't done so already, to do so, and also access that link on the video on the demonstration counties in Kenya, and also the paper on case management. That's all available. Also, just to announce that this is the end of phase 3 of this platform, of the learning platform on care reform. And the exciting news is that UNICEF has recently secured additional resources from USAID to continue the platform's success with phase 4. And we'll be starting off pretty quickly so that it will be smooth. You will not be able to feel the transition from phase 3 to 4. So looking ahead, our next webinar will be in early December, and we will look into kinship care based on the developed kinship care guidelines that the paper is available. I also want to take this opportunity to let everybody know, because I've been, part of this process from the very beginning. Look, we are starting to see the participant details. Sorry, I'm just going to divert there a little bit. Thank you to all of you who have, let us know who you are and where you're connecting from. And also pleased to see government participation at 19%. you know, and also thanking the government of Namibia for being one of the panelists today. That's greatly appreciated. So, excuse me. So yeah, we're going to have that webinar, and also requesting participants to stay on for an additional 30 minutes. This was announced earlier by Emily. We want you to stay on for an additional 30 minutes so that you can participate in an evaluation of the platform, because we need your feedback. It's really essential for us to improve and make this platform even better and more effective. So thank you for your continued support. And of course, let's keep working together for the well-being of children and families in the region and beyond. And lastly, just to announce, this is my last webinar that I'll be facilitating and introducing this year. I'm transitioning to another office in UNICEF. I'll be going to the UNICEF Nigeria country office, but nevertheless, there'll be somebody else recruited pretty quickly, and that person, once on board, will continue to accompany you in this process. So thanking all of you for your rich engagement, and care reform continues to be, very close to my heart. All the key lessons learned that I'll take from this region. I'll also see how best I understand the next region, the country office, and see how to apply the various good practices. So with that, I thank you, and I'm now passing the floor to Emily to take us through the evaluation. Thank you.
Wonderful, Mona, and a huge thank you from me, and I'm sure from many of the other participants, for your kind of championing of care reform in the region, and also of setting up this learning platform. We're all really going to miss you a lot, but we hope we'll be able to bring you back in from Nigeria. Okay, I'm going to stop recording now, and I'm going to hopefully hand over to my colleague Ishmael, because I'm going to step out for this part of the webinar. Ishmael, are you there? Yep. Yeah.
Hi, Emily. Sorry, I'm here.
Okay, wonderful. So I'm going to stop recording now, and I'm going to step away, and Ishmael's going to take you through a short 30-minute evaluation of the platform. If you are unable to stay on for this, you can email me, and I've put my email address in the chat box if you'd like to participate in another way. I'm really sorry we can't offer translation for this section of the discussion, but again, if you're French or Portuguese speaking and you want to contribute to the evaluation, please just email me and we'll find a way for you to share your views. So I'm just going to turn off my video, but I'm not in the room anymore. I'm going to go to another part of my house. I'm not able to leave the meeting because I'm the host, but I won't be here to listen in, and so you can give your honest views on the platform. We really, really appreciate your feedback. Thank you. Okay, over to you, Ishmael. I'm just turning